What, in your view, are some of the practical signs that an organization is truly becoming human-centered? You've worked with many of them, seen the trends over the last years. What do you observe is really are good indications of a human-centered culture?
It's going to seem hard to measure when I share this, but it is creating the space for people to lead in any moment. It's not the checklists, it's not the practices or the training that we necessarily give people. That's the scaffolding around it, but it's creating environments where people can lead in every moment, that we give a space for a food service worker to hear that it's someone's birthday and find a solution to make them feel heard or loved in that moment. It's an opportunity for someone walking down the hall to stop, even though they're supposed to be somewhere else, and care for someone that looks either lost or confused, or answer the question of someone in distress. And when we create the environment where people feel as if they can act in the moment with a level of agility and concern to show compassion and also intent, then I think we've created an environment that isn't boxes and lines. And I think so often in healthcare, to survive the chaotic system that we built, we've had to structure it really rigorously and tight, right? We've got boxes that do certain things, that pass things to other boxes that do certain things. And so because of both that rigidity and structure, we've also created gaps and spaces, and we've lost in some ways that agility. The organizations that get a human-centered approach right soften those edges just enough that people can act in a way that doesn't keep them just in their box. And it actually then eases transition. It creates connection. It improves flow and communication and ultimately outcomes. And so it's the subtle thing, but I love to watch for organizations where people, it's not just that I'm happy to work here. That's great, yes, but that people feel like they can lead in their moment in a way that's meaningful to the outcomes that the overall organization is trying to achieve.
Yeah, that's a great analogy. And it reminds me that, as much as there need to be systems and processes and standards and all of that, that we can't forget that humans are not widgets in a factory to be manufactured. We are, as a species, a social species, this is about relationships and communities. And we need to make sure those systems, policies, and processes are enabling those things rather than interfering with those
Yeah,
things.
100%.
Cool. What is the role? You've mentioned this a little bit in passing, but in your view, given the cultures that we are aspiring to, what is the role of surveys and scores and metrics and all of that? Where should they fit in? How do we get them in the right, priority relative to all the other things we've been talking about?
Let me say what I don't think it should be first. It shouldn't be a stick. And I think for a long time, survey results became sticks for people versus means and motivations for action, right?
Mhm.
When the spreadsheet comes out and it's red, yellow, green, and you're told you need to get your reds up, right? It gets, like I said before, it becomes a game of whack-a-mole, of like addressing the problem and taking your eye off another one. I think that data is incredibly important. I'm a researcher too. I love data. It's how we use it that matters. And right, data tells us stories. But let me say this, stories are also data. And so our ability to collect both is really important. So I think the role of surveys and metrics is, again, a means for us to triangulate what's happening in our organizations. And, I always say, you've heard me say this before, as much as I'm a researcher and I love sample sizes, the real sample size and experience still is the N of one, right? That one person in front of you in any moment. But when we gather data, we can begin to see patterns. We can understand where there's opportunities. And if we're willing to see the use of data as a chance to improve and to take action, that's where its real value is. So domain chasing in the United States around caps is a problem, I think, because it's not necessarily about generally lifting the tide for our organization. It's about making responsiveness better, right? And when you do that and you throw all your resources there, you forget about the other one over here, and you're on this kind of swivel all the time. So I do think the opportunity that we have with surveys and data is to use it in a way that it captures what we want to know in a way that's meaningful, that it also allows people to tell us what they want to tell us, and that as a result of that, we use it in a way to take action, and we close that loop back to people. I was visiting a hospital in the UK. It's been a while ago, and I was on one of my rounds with them, and we were in a unit, and I saw this family member standing in the hallway looking at a board. It just looked like construction paper with bubbles on it. And you know what it was? It was this board that said, "You said, we did." And it was a patient comment and a responded action. Patient comment and responded action. Patient comment. And right, that family member, this wasn't their family member's comment because they didn't get the survey yet. It was someone else's family member. But standing there in that moment, I could see a level of confidence and comfort because the data was action, the data was living, and it meant something in terms of what was going to happen as a result. I am sure those family members filled out their survey when they got it. And I'm sure that the data and the stories that they shared were used to do something else. So that to me is the most critical thing we can be doing. And our organizations, great organizations like PRC here that gather data are really, I believe, being champions for it beyond numbers to something that can be meaningful and leading in transforming change in healthcare.
You cited a really great example, and it reminds me of something that I think is a great opportunity for anybody working in patient experience, and that is we need to tell patients when we change things in response to their feedback. Back when I was doing customer experience feedback in a company outside of healthcare, we had the insight to, hey, here are all the things you told us about over the last 6 months, and here are the things that we changed. Just by telling people that alone jumped their satisfaction scores by 10 points, simply by communicating that. We can't assume that the patient knows that it was changed if they haven't come in contact with that. So that's a really, really great insight.
And it comes back to that first point on the consumer research that we consistently do year after year. Listen to me. I mean, people want to know, right? You can't just say you did. You got to show them. And I think when people feel listened to, either in their clinical encounter or as a result of the feedback they give, it does create a really positive, reaffirming environment that enables all sorts of outcomes to be achieved.
Absolutely. So looking ahead 5 years, given what you've seen over the last 15, 16, what do you think is going to define the most admired healthcare organizations from an experience perspective? Any thoughts on that, where we're headed?
I think places that can really are willing, let me say it this way, are willing to wear their humanity on their sleeves, right? First and foremost, our priority in healthcare is to create the best in clinical safe outcomes for everyone that we care for. One, first and foremost. But I would say that is the ultimate in experience outcomes, right? I don't think patients and family members distinguish quality safety outcomes from the experience they have in our healthcare institutions. So what I would say with that statement is that organizations that understand how important it is to integrate those into an overall experience strategy are the ones that will win. If we're continually separating a commitment to safety or quality, a commitment to experience as just service, and we don't think about what we do from the lens of the people who live in our institutions every day or show up to get care from us every day, then we are still operationalizing healthcare for us, the people that show up to work every day, the people that need to meet the numbers, right? We should, and I believe those institutions that we most admired are inverting that entire equation, that we are integrating our solutions in a way that we understand what it is people expect from us. They're getting the highest quality, most safe outcomes in a way that they feel listened to and respected. And all of that to them is their experience. We set it up well before they ever come in. They want to choose us. And the way that we follow up and the stories that they tell reflect their journey through the clinical part of their healthcare encounter. And those are the places that will stand out, that can tell those kind of stories around how we aren't the best in quality, or we've been acknowledged by this one metric, but not that one. And so I would love us to be able to show collectively what those true organizations are that understand experience at that totality, right? At the level of human experience. And we can show even now, Chris, like we talked about, the outcomes that delivers. Those are going to be the places that ultimately change healthcare, that will lead the way in the next decade. And I'm looking forward to seeing how they continue to transform healthcare.